Thinking if tubal ligation is good for you? This is a female sterilization which prevents the egg from passing through the fallopian tube. The tubes are connected to the ovaries to the uterus. During the incision, you can decide whether you want your tubes tied, cut, clipped, burned, or blocked. Sometimes a small piece of tube is removed. It will be done in the hospital or an outpatient clinic. Procedure takes around 30 minutes. The medicine given to the patient will be anesthesia, which they will fall asleep unable to feel pain. This picture is 3 types of an incision. The first left is an example of being banded, the middle is being burned, the last on the right is being tied and cut. The slight risk of becoming pregnant after tubal ligation happens to be about 5 out of 1,000 women after 1 year. After a total of 5 years, about 13 out of 1,000 women will or have become pregnant. Most kinds of sterilization for women will be effective right away. If you are interested in getting sterilized, talk with a healthcare provider. Contact your family doctor, a local hospital, or a local public health department. The cost of the tubal ligation surgery will be around $1,500 to $6,000. Planned Parenthood works to make healthcare accessible and affordable. Some health centers are able to charge accordingly to income. Most accept health insurance. If you qualify, Medicaid or other state programs may lower your health care costs. This incision will be safe and simple and will last for life. Women who are engaged in sexual intercourse do not have to be worried about being pregnant. Some women and men say they have more sexual pleasure because they do not have to worry about pregnancy anymore. Tubal ligation incision does not change your hormones. It will not make women have menopause earlier. Women will have normal periods after the incision. You can have sexual intercourse as soon as you feel like it. If you want to have the biological children later, this incision will not be good for you. The tubal ligation is not good for long-term method. After the incision can cause bleeding, infection, reaction to the anesthesia. Some may go through these symptoms after tubal ligation: headaches, heavy periods, body aches, mood swings, night sweats, anxiety, and depression. Tubal ligation does not protect you from sexually transmitted diseases. After the incision, protect yourself by using latex, female condoms, or male condoms. This will reduce your risk of diseases. These 2 pictures are demonstrations. The top left is in use for women condoms, and the right bottom is in use for men condom. This is for safe sex. This is an example of a woman's lower body and where the tubal ligation incision is done. It shows where the tubes are tied. Healthcare providers will help you make a decision on which kind of sterilization might be right for you. Your medical history will be important.